Hi, I'm Dr. Kelly Starrett from the Ready State. One of the reasons we love early H-wave intervention when we know we're having surgery or right after trauma is to prevent this really scary sounding thing from happening called disuse atrophy. One of the problems with sort of taking a limb or a tissue system out of its normal programming, just normal everyday activities of daily living or exercise, is that we suddenly don't get a lot of movement in there. And our brains and our bodies are really designed for optimizing towards efficiency, which in the short term means if my brain doesn't need this leg, it's going to start to shed a lot of the muscle mass, a lot of the sort of, contractile features of the system, because it's metabolically very expensive to keep this musculature around, especially if I'm not going to use it. And disuse atrophy happens very quickly. When we see people in the hospital, one of the first things we try to do is get them sitting up, get them walking around under their own power very quickly, because we see radical detraining happen very quickly. In just a few short days, our brains are like, oh, we're not moving this thing, we're not using this body, let's go ahead and start to shut down and pare down some of those functions. Now, of course, we can retrain the body at any age. You can get stronger, we don't stop healing. That is available to us throughout the entire life cycle of the human being. However, it's a lot easier to just go ahead and maintain muscle mass and connective tissue than it is to go ahead and try to regrow it, especially as we get older. Well, the good news is when I intervene with an H-wave and just create a non-fatiguing muscle contraction working in the background, that's enough for my brain to appreciate that this musculature is still connected to the system. And what we're honestly doing is sort of short-circuiting how the brain is perceiving what's happening with the body, in so much that now the brain is saying, oh, we have movement without motion. So we're getting movement, and my brain is saying, oh, I'm firing those quads, I'm firing those hamstrings, I'm firing whatever muscle system I'm working on. And what's happening then is that without actually having to move the limb, I'm able to keep this neuromuscular system plugged in. Again, brain-muscle kind of connection. And so what's great then is that we don't have to then just wait around for healing to happen and then, okay, now let's begin to reclaim all of that muscle tissue. And by the way, it's real difficult when we see people lose quad mass after an ACL surgery to try to reclaim that quad mass. We often can tell what side a person's had a surgery on just by the asymmetry in terms of muscle volume. And of course, muscle volume isn't the end-all be-all, but aesthetically, functionally, it's a lot easier to hold on to the muscles you have instead of trying to regrow that muscle or retrain that muscle after a period of inactivity. So in short, yes, we have on-demand pain relief, we can really manage congestion, we can keep neuromuscular control, but also we can keep that hard-working metabolic tissue that when we have worked so hard to maintain when we have surgery or trauma. So the bottom line is, let's banish disuse atrophy. Let's get us moving as early as possible. And we begin to view H-Wave as a movement company first, then it starts to make a lot of sense. This is why we love H-Wave and early interventions after surgery and trauma. Hi, I'm Dr. Kelly Starrett. One of the reasons we love early use of H-Wave is that it can help us manage fear of moving our bodies after surgery. Look, it's very reasonable after surgery, after trauma, to be a little bit fearful or fear protective of that repaired or injured site. So oftentimes when a physical therapist comes in for the first time, what we're really talking about is saying, hey, how can we help you identify movement as non-threatening? How can I give you confidence to say, hey, it's okay to move and you're not going to hurt yourself? Especially when people don't have a lot of background managing injuries, managing tweaks. They've heard a lot, they've Googled their injury or surgery on the internet, and now they're very fearful. One of the things that we get when we have early pumping of the movement system using the H-Wave is that it allows the brain to understand that it's safe to create contraction here. And oftentimes, believe it or not, the psychology is simple, that if someone just sees a limb pumping and muscles moving, they're going to say, well, I've been doing this all along. Ever since surgery, I've been moving and pumping, so I'm going to be less fearful. whether they buy into it or not, whether they're meta-aware of that process happening or not, the simple fact that the tissues are moving and we're getting that non-threatening input into the system that the brain perceives as pain-free and threat-free means that it's easy for me to start to want to load and begin to move. And oftentimes when people are protective, because it is painful to move, when we begin to untangle that, we have to sort of show the brain that it's safe to load. And that's a really important sort of framework for understanding a lot of the seemingly miraculous outcomes that we have with H-wave. The brain is wired for threat or non-threat, and a lot of what we're trying to do is signal to the brain that it's safe to move again. We might be interacting with sort of deep tissue physiology. We're decongesting, we're improving blood flow, we're loading tendons and ligaments at a small level. However, the brain is saying that, oh, look, it's safe to move these things. We've been getting this non-threatening input, this 2 pumps a second for many, many, many minutes. And that means that when it's time to go under volitional or automatic control, I'm suddenly ready to do it. And so one of the reasons that I am such an advocate of this is that it helps us to signal that it's safe to move again. If we add in the high frequency where we can give someone some pain relief, where I can help them manage or eliminate or attenuate their pain symptoms after surgery, which is normal and typical, plus getting that movement in, it's a win-win-win. As soon as we can get someone to perceive that it's safe to move again, the healing takes off. Hi, I'm Dr. Kelly Starrett with The Ready State. When we are helping people use the H-wave for the first time, especially after surgery, one of the things that we have to explain is that it's okay to access the high frequency and the low frequency settings at the same time. It's crazy. Oftentimes, because we don't have a lot of experience using an NMES device, a neuromuscular electric stim device, what ends up happening is that we think, oh, I only can be managing pain, or I can only be managing sort of congestion at the same time. Remember that the goal always is to get as much non-threatening input into the body as we can. But one of the nice things about sort of having 2 leads is that I can use one of the leads to manage some on-demand pain relief, which means that I can lessen my sensation, which means I might be able to handle a little bit more contraction of that system. Or, hey, that muscle contraction isn't even interfering or making me uncomfortable, but I don't want to take an hour off of staying ahead of the swelling congestion. So what we love is that you can use one set of pads for some high frequency, get that on-demand pain relief, give yourself some rebound breathing room for many hours afterwards while you're simultaneously pumping. Which means then that once I've done my 45 minutes to an hour of high frequency, I just flip it over and start pumping again. So what's great is I can literally be thinking, hey, I'm going to get as many minutes on this device as I can. Great if I get it a little bit in the morning, a little bit in the evening, a little bit maybe at lunch. I'm a love to pump all night long if that's possible. It's a sneaky way of allowing our athletes to get way far ahead of the congestion for the next day. But I can just easily switch to, oh, I'm feeling a little achy, want to not lean into those sort of medications that are a possibility. I know I can manage this with my high frequency setting. So I just switch, drop right back in, give myself a little high frequency dose, feel better, and then go right back to pumping. Remember, the goal to return the body to its normal state is movement. The H-wave helps me to manage pain so I can move. H-wave high frequency allows me to get some on-demand pain relief so that I can use that window of opportunity to walk around my couch, do my physical therapy exercises, fall asleep, whatever it is. And then the low frequency setting is getting tons and tons of non-threatening input where I get to improve blood flow, remove congestion, keep that muscle and limb plugged into the brain, and signal to my brain and to my own self it's safe to move. The goal here is that to recognize that this H-wave technology is really a movement technology. Hi, I'm Dr. Kelly Starrett with The Ready State, and I'm asked often, should I use my H-wave before surgery or should I wait till start to use it after the surgery? And we are big fans of integrating this amazing technology into my pre-surgical process for a few reasons. Number one,
the more comfortable I can get with pad placement, understanding how to use high frequency and low frequency, how I can adjust positions of the pads to have different outcomes of muscle recruitment, all of that makes it effortless to engage with brand new technology when I'm in a little bit more of a threatened post-surgical state. So absolutely, just get comfortable with it, start using it, start to feel how simple it is to integrate this extraordinary technology into sort of your pre-game process, because it's going to be a lot easier when you get home from the hospital. Number two, we're trying to keep as much muscle mass on the athlete as on the patient as we possibly can. And an inhibited musculature system, a system that's swollen and congested, doesn't move, and that inhibition that begins when I have a big swollen joint or a big swollen tissue system often leads to a real quick disuse atrophy. So the earlier I can get that muscle recruited, that neuromuscular recruitment drives a lot of protective mechanisms that keeps me from losing this mass. So I'm worried about having a quad smaller than the other quad, or keeping my muscle the same on both sides, or just maintaining function, keeping the leg plugged into the system makes a big difference. Three is that a surgeon is going to want to work on a tissue system that isn't highly inflamed and very swollen. Oftentimes we hear that someone says, hey, I went and saw my surgeon, but she wants to see me in 2 or 3 weeks once the swelling has come down. And in those situations, I'm like, good, give me 24 hours. We can get ahead of this swelling. Which means that if we think about surgery as sort of controlled chaos, controlled trauma, the sort of more we can control some of those factors going into that, because I have a system that's comfortable with movement, a system that's got under good pain control, and a system that isn't congested, that means that the surgeon is going to have a lot easier job doing her thing. And we're not automatically loading up more trauma on a system that's already traumatized. So whenever we can get that tissue moving again, remember, H-wave is really just a movement device. It's a lot of movement without motion of the actual limb. I can keep that brain plugged into the tissue system, I can manage that congestion, and I can begin to think about, hey, I can actually get off some of this pain medication that I'm using to manage this post-trauma issue before going to surgery. Those are all win-win-win-wins. So the bottom line, should you get your H-wave before surgery? Yes, as early as you can, as often as you can, because it's only going to set you up for success on the other side. Hi, I'm Dr. Kelly Starrett from the Ready State. One of the reasons we love to use H-wave in surgical situations is it allows us to skip over this whole neuromuscular inhibition. If you've ever heard someone have knee surgery, for example, they'll often talk about the fact that they have a real hard time recruiting their quadriceps. In fact, a lot of the post-surgical sort of response from physical therapists and rehab after knee surgery is just keeping the knee sort of re-plugged into the brain. How do we reestablish this neuromuscular control? We have a whole bunch of exercises, active straight leg raise and quad pumps, and we're just trying to keep that knee musculature from being inhibited from the trauma around the knee. Well, guess what? Oftentimes when we use H-wave, we don't have this problem. We just skip right over. In fact, the faster we can get the H-wave on the affected limb, the earlier we can get this sort of motor recruitment, neuromuscular connection bridge reestablished, which is amazing. One of the things that happens is just by getting this non-fatiguing muscle contraction right away is that we reestablish this connection to the brain. We're getting 2 pumps a minute, and the brain says, oh, I know how to recruit that. Additionally, even when people are numb, we can still be actually practicing firing the quadriceps when the move is pumping or when the leg is pumping. So what ends up happening is that I'm getting 2 pumps a second, that's 2 hertz, and I can do a quad set with each one of those. So I can kind of use it to jumpstart the system. The H-wave is actually FDA cleared for neuromuscular rehabilitation. But we often find that we don't have to even use it for those things if we can have early enough intervention where we can keep that connection alive. And literally, one of the things that happens is that my athletes come out of surgery and they're like, I didn't even have a knee problem. I didn't have extensor lag. I was able to maintain my quads. And that puts things on like disuse atrophy off the table, which means that disuse atrophy means if I don't use the muscle and I'm disconnected for a week or so, I oftentimes can start to eject and lose some of the structural proteins of that leg, which means that it's harder to reestablish control, it's harder to keep the mass on, harder to keep that strength. We want to nourish and keep that engaged as much as we can, and we do that through early activation. And that early activation means I just put on the pads and start pumping away. It's very, very easy. It's low sort of invasiveness. And even if we're seeing a leg that's highly bandaged, we just move the pads around until we get a solid contraction in some aspect of that leg. And oftentimes we're able to find enough real estate where I can still get a massive contraction without having to kind of disrupt the need to keep the area sterile and clean. The bottom line is, we think that an H-wave is a fast track to expedited healing. Because remember, you're either going to heal at the rate of a human being or heal slower than that. There's no such thing as a fast healer. But if you use an H-wave, your friends are going to think you are a Wolverine.